those are good numbers. I don't like to say the word good because they're really horrible numbers that show tremendous disrespect for our work. People disrespect us because they don't understand us. Sometimes people say it, maybe somebody has said this to you before, you could be a doctor, right? When you've said something, educated somebody about some health disease or process or how they could get better. They say that, of course, meaning nothing but the best for you and wanting to give you the biggest compliment possible. But it's actually a complete disrespect for the nursing profession because it, imagines that nurses don't know anything meaningful or substantive or helpful, or that we really don't have much of an ability to educate patients about health, or that we don't do anything meaningful. But the research out of the University of Pennsylvania shows that when you double a nurse's workload from 4 patients to 8, patient mortality increases by 31%. So this means that nurses save lives. People have written to me saying nurses don't save lives, physicians save lives. Okay, but if we go back to that study, if we stretch nurses thinner, if we doubled a nurse's workload and nurses didn't save lives, then patient mortality statistics would not change at all. So yes, nurses save lives. We've actually developed a bumper sticker. Some of you have got it on and in your hands, but Sania Tilden over there, who helps us, is at our little, I can't say it's a table since it's on the ground, but you can get free bumper stickers, and if you sign up for free news alerts, we'll give you a free RN patch or LPN patch, or we have a bunch of different patches over there, and we have the web address over there where you can sign up for our free news alerts. Water time. So when push comes to shove and resources are scarce, society gives its resources to the people they perceive to be the lifesavers, not the handholders and pillow fluffers. So the lack of real respect wastes lives. Hopefully not too many of us face the flying scalpels every day, as I mentioned earlier, but too many of us do face critical issues that threaten patients directly. And of course, one of the most important is understaffing. And so, as many speakers have mentioned before, when we don't have good enough staffing, it leads to healthcare errors and failure to rescue, and so now we have a case where the healthcare system is the 3rd leading cause of death in the U.S. healthcare. That is tremendous and terrifying. I know I have had several practitioners say, "Oh, you need surgery on your shoulder, or you need surgery on your knee." I just stopped going back. Like, okay, I'm going to see if my body can heal itself, because I'm not going to put myself into the healthcare system because of the tremendous number of errors. And basically, I'm limping along okay. I'm just going to let my body heal itself. So nurses are the professionals most likely to catch and prevent an error. So that's, extra indication that we are the ones who need more support for our profession. But if our views carried more weight, we would not be stretched so thin that many of us, can I have a show of hands, how many people have ever worked a 12-hour shift without even getting a bathroom break? Oh my God, that's 35% of you. That is horrible. And we're all going to have to start wearing Depends at work, right? Great. What a vision. So today is Florence Nightingale's birthday. I'm sure everyone knows that. And so we celebrate Nurses Day. Many people see her as this soft and cuddly person for some reason, and so they like to give us teddy bears with caps on them, and hearts and flowers. And can anyone, is it a show of hands, has anyone gotten such a gift, an angel-oriented, soft and cuddly teddy bear? Oh, only 20%. Oh, that's not too bad. That's not what I want for Nurses Day. But in reality, Nurse Nightingale was not so cuddly. She was a fierce advocate. She pressed government officials for enough resources to save patients. She fought with physicians to stake out nursing autonomy. I was actually at a speaking engagement overseas a couple months ago. The chief nursing officer reported to the chief medical officer. I fought it for many months, and I've been having a hard time making headway. But there are still places, and maybe, does anybody work at a hospital where the chief nursing officer reports to the chief medical officer? Oh, there's people in the U.S. who raise their hands. Wait, 3? Show of hands again? I want to count. I think 3. Oh gosh, that's awful. We need to talk. That's horrible. So, but nurses need to answer to nurses all the way up to the board of directors, which I believe every hospital should be run by a majority of nurses. Since hospitals are nursing institutions, we should not allow bankers to direct our facilities. And I did a little research study on the top 17 hospitals across the U.S. and examined all the boards of directors, and most of the hospitals didn't have any nurses on them, and several of them had 1. And that's it. That's the most I could find on any board of directors at these nursing institutions. So a lot of our weakness goes back to because we are largely a female profession, and females have longly been disrespected solely because of our gender. You know, women have always been assigned the most difficult work in the world, the raising of children and the teaching of children and the taking care of the sick. What is more difficult than that work, right? And so just because it has been done by nurses, done by women, it has been assigned a lower value because we are wrongly devalued just because many of us are female. And thank you to the men who have joined the nursing profession, because we need more gender diversity. We've had a lot of progress in terms of feminism, but I believe we have another step to take in terms of now women can do the jobs that men have long done. But I would like to see the world transformed into one where the work that women have long done is valued in line with its worth, instead of disrespected because it has been done by women. So short staffing just doesn't hurt patients. It drives nurses out of the profession. But nurses are a national resource. They're an international resource. We have a global nursing shortage. We have 16 million nurses in the world. And in the United States, we have about 1 nurse for every 100 members of society. If that same ratio were true across the whole globe, we would have 70 million nurses. We only have 16 million. We need 70 million. That is a huge global nursing shortage. Yet our country and many other developed countries import nurses from less well-off countries. And so I have read many articles about hospitals, especially in Africa, where the ratios are 1 to 80, 1 to 200 patients, not in society, but in the hospital. How could you possibly go to a hospital and expect good care? So we need to, as human beings, as we are the most ethical and honest people, right, we should be exporting nurses, because our patients are not just the patients in the bed before us. They're every human on earth is our patient, I believe. And so we need to strengthen nursing for everyone. Kids in schools routinely die because there is no professional nurse at their school. And this is unacceptable, absolutely. We should have at least 1 nurse for every 750 children. Kids have life-threatening allergies, and they're going to school now quite sick, and we need nurses in schools. And this is another form of short staffing that we need to contend with one day. Nurse-family partnerships, in which nurses guide young children. There's just a good article in the Washington Post the other day that they're only 3% of eligible families are funded, because the whole program is undervalued. It's undervalued probably because the word nurse is in the title, because people don't respect us as we should be respected. So because they're not funded as well, we have more crime, more child mortality, child abuse, substance abuse, and other problems that we could have prevented if we were funded in the first place to prevent them. Young nurses might not know this, but in the early 1990s, I graduated from undergrad in 1984, and for 6 years, it was the staffing wasn't so bad. It was pretty good. Any other nurses practiced before 1990. Yeah, it wasn't so bad, was it? It was a little short. I could have used more staffing, but it's nothing like today. It's severe. But this healthcare cost cutting has overwhelmed the nursing, and it has been made us unable to provide the level of care that we're capable of providing. So patients die. Insurance companies slashed lengths of stay, and so nurse and moms are still sent out of the hospital before their milk comes in, so we aren't even able to educate them about how to breastfeed. So no wonder that we have abysmal breastfeeding rates, which could save many lives.
He's learning.
Who is this? Oh, it's him. I could relinquish the stage. I like that he's listening. All right, I'm going to take back the stage. He was entertaining for a while. I liked it when he was talking about nursing, but he's lost the thread. All right, so back to the deeper causes of the global nursing shortage and short staffing. Nursing was an easy target because for many decades the profession has been subject to stereotypes. And these attitudes continue to undermine our efforts to get respect and resources. And they're very much related to the fact that, as I mentioned before, female. And so several stereotypes that stem from our femaleness are the naughty nurse stereotype, I'm sure you've seen. And at The Truth About Nursing, over the past 15 years, we've actually had quite a bit of success removing various commercials, mostly, featuring the naughty nurse. And you can see on our website, truthaboutnursing.org, some of the ads we were able to remove, including ones by Disney, who tried to honor us for Nurses Day with little naughty nurse pins. Really, we got 2 of those removed, yeah. Skechers, Heineken, Cadbury Schweppes, Pennzoil. Dr. Phil and Dr. Oz both embraced the naughty nurse stereotype, and we got them to kind of apologize. Excuse me. And we know that they're always lighthearted, and people say, oh, it's just a joke. But jokes hurt people. Jokes aren't jokes unless everyone is laughing. And in the case of nurse, we're not laughing. It suggests that nurses exist to provide sexual services to patients and or physicians. And that's a pretty demeaning way to project us. Who's going to fund our education if they think all we do is provide sex for patients? And it's extremely demoralizing to the men in the profession why would you want to come into a professional prostitute job? I don't know what man would want that, but here you are, and I'm so proud that you overcame that to join us. Then the angel stereotype I mentioned before is the hand-holding, pillow fluffing, and the idea, like, where do nurses live? Where do angels live? They live in heaven, right? So you don't need a good paycheck to pay the rent. And angels don't have kids, so you can work mandatory overtime because you don't have to go home and take care of them. And angels, of course, don't eat or go to the bathroom, so you can work your 12-hour shift. I'm going to give the floor to him for a minute.
Well, that's what he said. He said if you repeat nurses 10 times, I'll leave.
Oh, okay. There's the unskilled stereotype. Sorry, I can't. I do need more water. Sorry about that. I got something in my throat.
They are.
So there's the idea reinforced by the media that nurses are unskilled, that we just push gurneys or fetch things for physicians or empty bedpans. Specifically about bedpans, let's look at them. There's a lot of disdain in the media for people who empty bedpans. It's seen as the lowest type of work that humans could possibly do. But when you empty a bedpan, you can find symptoms of kidney, liver, gallbladder disease, intestinal tumors, intestinal bleeding. So bedpans are full of data. And if you take the data and flush it down the toilet, if you take it, uneducated, I have 5 minutes, I have to wind this up, okay. If you take, an assistant and they flush the data down the toilet without a nurse looking at it, then the patient goes home and dies. We need to do what people perceive bedpan work to be so lowly, but it's not. We need to have our eyes on every aspect of the patient, and educating the world about even the most lowly work, or perceived lowly work that we do, is a way to increase public understanding of nursing, and with understanding comes respect. One of the other big images is also the handmaiden image, that physicians control us and we must necessarily do whatever they command us to do. And physicians, on television, they do the high stakes triage, defibrillation, high tech ICU care. But this is the real life work of nurses. And we need to get credit for the work that we do. Physicians do great work, and of course they deserve a lot of credit for the work that they do, but they don't deserve credit for the work that we do. And so we need to transform the media to portray reality, to give us credit. When the whole public understands the value of what we do, that will affect hospital managers and members of Congress, and affect legislation and just who comes into the profession. So we need to change how people think about nursing to increase respect, so we can get the resources that we need to provide excellent care. So one way to change thinking is something I'd like to challenge you all to do, in terms of we must stake out our autonomy, as Nightingale did. Is the word orders, I believe, is undermining our ability to provide good care. Physicians think that they are in charge of us because we allow them to use the word orders. So I would like to replace this with the word prescriptions. They can prescribe medications or treatments or tests, but they are not ordering anybody to do anything. They are not in charge of us. The patients are in charge of us. They tell us what we may and may not do. We answer to senior nurses, but we are two separate professions. And if we don't like something physicians have prescribed, then of course we're legally bound not to do this. So we can't allow them to use the word orders. It makes them think they're in charge of us, and it makes some nurses who didn't go to the autonomy classes in nursing school think that we do answer to physicians, that we have to do whatever they say. I was just speaking at a conference in Vancouver, and they have all of the nursing educators who educate, not all of them, but some of them, educate nurses educated abroad, had come, because it's very hard, especially for them, to articulate their autonomy. But I believe that starts with getting rid of the word orders, replacing it with prescriptions. So I better skip over some of this because I've been given my 5 minutes. And now I'm just come to a halt here. So we need to use a lot of research. When we advocate for staffing, we should use the research that's been done as tools. Basically show people the research, how short staffing leads to death, and use it as an arsenal, basically, in our fight. This bolsters our arguments. Other ideas about how to increase public understanding of nursing is nursing out loud. When you assess a patient, talk out loud about what it is you see and hear and decide is wrong with the patient, so patients and their families and listening physicians will know that we are making assessments and decisions that people don't know that we do right now. And bedside shift reports are one way to also do that. Try getting yourself placed on decision-making committees or board of directors. I argue in my op-ed that ran in the Baltimore Sun today that since hospitals are nursing institutions, as I mentioned before, they should be run by a majority of nurses. We need nurses to create television shows, op-eds, books for children. Almost all the healthcare books for children are aimed at having them become physicians. We need books out there having them, helping them imagine that they will become nurses. And please keep a journal when you go to work every day. Come home and write down the really interesting stories that you've encountered. Nurse Jennifer Worth kept a memoir of her stories, and that's why we have the fantastic television series Call the Midwife. Yes, if you haven't watched it, you've got to watch it. It's really great for nursing. It wins our 10 Best Media Depictions of the Year award for the past several years since it's been on. So we have many more ideas about how we can improve public understanding of nursing. With understanding comes respect, and with respect will come safer staffing. So it's on our website, truthaboutnursing.org/action. It's our action page. And again, Sania Tilden's over there. So let's start today educating the world about our life-saving value with stories about how we save lives, about using research, showing our value, and the cost effectiveness of what we do. It's extremely important. And this can help sway the finance people who are sadly in charge of how much nursing care we're allowed to give. We need a federal law requiring minimum staffing ratios. The lives of our patients depend upon it. Wonderful. So, and tomorrow, let's push for the kind of change that will carry this forward, doing whatever we can do in our own practices, our own lives, to help get nursing more resources and more support. And that way we can save all of the lives we are capable of saving. I know we can do it. And thank you so much.
Thank you so much, Sandy, for being so understanding and for enlightening us. Our next guest probably needs no introduction. Her name is Jamie Harvey Garner. She is she started the Show Me Your Stethoscope Foundation by accident, but she did start it. And she's here to talk with us for a little bit today, and then we're going to be having pizza when it gets here. It should be here fairly soon. And let's have Janie come on up. Yes, go Janie.
Hey guys, so show me your stethoscope. See, I've always wanted to do that in person. I only ever got to do it on Facebook. So, I'm all like, "Ooh, look, bling, bling, I have it right here." Okay, I have to put this back here because I'm not as coordinated as Melissa. There we go. Much better. Okay, so Jaleel Johnson, who is our national director, is going to be terrified with what I'm going to say right now. I have no idea what I want to say to you. I basically come up with ideas for Show Me Your Stethoscope with my harebrained craziness, and I go, "Ooh, look, that needs to be done, so let's do it." And that's exactly what's happened today. So I came in here wanting to talk to you about nurse unity, because frankly, nurses have never, ever, ever come together the way that they did for Show Me Your Stethoscope. Nobody was more shocked than me, be clear. It was an accident. I thought 50 people from the ER were going to show me their stethoscope, okay? My coworkers. And then, whoops! Ooh, hi guys. So, 815,000 at the Pinnacle. Anyway, so today in Show Me Your Stethoscope, I heard about a nurse who was assaulted by one of her patient's parents and fired for calling the police. And this is in New York, where it's illegal to do that. So it's a felony to assault a healthcare provider, but it's okay for a company to fire a home care nurse who has been assaulted. So are you going to put up with that? Is that what's like? Is that how you feel about your profession? You're just going to say, "Oh, well, too bad for her." No. Okay, because it's ridiculous. We are punching bags, line items, okay? And I'm done with it. I'm an old lady. I'm 44 now. Okay? Old, fat, and sick of it. And I have a bad back and all these things. I could complain to you all day. Girl, let me tell you. But the really important part about all this, did somebody leave their patient over there? Okay. The really important part about this is not so much that we bring light to individual issues, but that we are united in our approach to our profession. And with Show Me Your Stethoscope, we all came together because one bunch of dumb talk show hosts, by the way, I never watched TV before that happened. Somebody had to tell me who they were. Because one group of talk show hosts was nasty to one nurse. And we all came together and went, oh, wow, you know, we can't put up with that. And yet we're all here and we'll go home tonight and probably never, ever, ever think about Dawn, who was assaulted by her patient's mother. I want to change that. I want us to not allow that. You do not have to be a punching bag. You do not have to take 10 patients on med-surg. You do not have to take 4 patients in the ICU. And you don't have to go home and worry about whether or not you killed somebody today. Okay, I made myself cry. That sucks. But anyway, guys, that's what all this is about. This is about unity. And Nurses Take DC, while it's about safe staffing, is about unity, because nothing is going to happen unless you get in there and do something about it. I've been posting this little meme, and it's like, it's the Lorax meme, and it's like, nothing's ever going to change unless somebody really, really good does it, whatever the Lorax quote is. Well, that's it. That's you guys, okay? You guys are the good people who have to come in and do the good things and say, hey, we're not going to handle, we can't handle this anymore. We're not going to do it. And if everyone does it, guess what? They can't fire everybody, because they can't just pick up somebody on the street to come in and do your job. You are valuable, you are beautiful, and you are loved. Especially here. Okay? Don't let them do it to you. And show me your... Hey, man, I love all you guys. Awesome, Woo! Yeah, there it is. Yeah. All right. Mine has bling on it. I don't want to talk to any infection control nurses after this program. Okay. So Dawn was assaulted by her patient's mother, who's a known problem. And Dawn was fired for calling the police. So today, when you get done here, I want you to start tweeting out hashtag protect Dawn. Because Dawn is who we are. Dawn is all of us, because it could happen to any of you. I have been told that I would be fired if I called the police when an ER patient punched me in the face. So there we are.
Who's ever been assaulted on the job?
Yeah, been assaulted on the job? Raise it up. Were charges pressed? Keep your hands up.
Yes.
Woo! Yay!
Yes.
Melissa got charges. Woo, Melissa! Okay, so we've been through unity, workplace violence. I don't have the stomach for bullying today. You guys are awesome. And patient ratios, and the fact that you need to respect yourselves, respect your profession, and stick up for each other. That is what's important here. Be excellent to each other, man. Bill and Ted's Excellent Adventure. Let's take some great movie quotes. So that's all I'm going to say today. I'm not super long-winded. I am like, and quite honestly, all the people I work with are way smarter than me. I just come up here and go, oh, look, stethoscope, and then we're done. All right, woo! Woo! Okay. Hi, show me your stethoscope. Hi, Kelsey's taking pictures. Paul's taking pictures. Oh, live stream. Do I look fat on this live stream? You look fat all the time, JD, all the time. go to the gym.
Let's go to the Southwest for Janie.
Woo! Yeah, guys, thanks for getting me here yesterday, because frankly, I don't think I would have gotten here if you hadn't bullied Southwest into it. And then it hailed on the plane when we were backed up from the gate, and they had to pull the plane back up and do a hail inspection.
Hail Mary.
Hail Mary, yes. Okay.
When you were kidnapped by your admin team.
Yeah, and look for the blog later, because I have an entire blog that's entitled "The Kidnapping - Mistakes Have Been Made." So, all right. So I'm not going to talk much more. The deal is that we have a plan for Nurses Take DC 2017. Are you going to be here? You be here and bring a couple of your friends, maybe, and fill the lawn, because we can do that. And if we have more people, then we're louder than our patient that was on the bike. Okay, so Jaleel Johnson, who you heard from a little while ago, is our national director, and he is my good right arm. And pretty much nothing would get done without Jaleel, because I have the attention span of a chicken. So it's, I don't have much of an attention span. But Jaleel is bringing somebody to the podium that we would like to introduce to you. And I am going to let Jaleel explain the significance of this person and tell you what's going to happen and what you are going to be asked to participate in this coming year. And I really hope you decide to do that. So stay calm, guys, and show me your stethoscope one more time. That's it.
So one more time for Janie. They kind of call her like mama in the group, you know. She's very sweet, but she's also really, really, really smart. So she lets us play, and she has great ideas that pop out of nowhere, and then she says, we need to operationalize this, we need to make this happen. We're really lucky that we are surrounded by awesome people that can give us their time and their energy. So we get to operationalize things. We get to take a Facebook group and we get to make that into an organization, and then we get to make change groups all across the country. We get to have them organize and advocate for themselves instead of waiting for, I don't know, another organization to tell them where to go. They just do that on their own. And that's awesome. It's the power, it's people power. It's people just doing what they want to do and advocating for themselves. And that's what this is all about. So I want to introduce you guys to a world-renowned person. This is a conceptual idea, and the people that show me your stethoscope will probably tell you I kind of live in the clouds with conceptual ideas, but follow me, okay? So this is a person that every nurse knows, every physician knows, every nurse's assistant knows, every student probably knows, everyone knows this person, all right? It's the 8th patient that you have when you're working med-surg. It's the 4th patient in the ICU. It's the 4th, baby you have in the NICU. I don't know what the ratios are supposed to be there, but I'm sorry, I don't do babies. But you follow me, right? It's the 40th patient on a night shift in long-term care. It's the one that you can't get to, right? It's the one that falls down because you just didn't have time to get there. It's the one that breaks their hip because you didn't have the right tools, you didn't have enough energy, you just couldn't get it right. Everyone knows this patient, right? So what's been happening in this discussion about safe staffing and safe staffing legislation this discussion has been going on and on and on and on for a really long time. We have lots of really great organizations that are working on this. People are talking about it constantly. It hasn't happened. 20 years ago, there was a rally here for the same problem. So at some point, you have to say, what we're doing isn't working. Now, what we're going to do, we'll find out if it works. But what we do know is that all of you people are awesome, and you showed up because you care. There's a lot, and there's a lot of power in that. So this mannequin over here represents Pat. Okay? So Pat is a genderless, raceless individual, ageless, but Pat is this person that everyone knows. And Pat's going to take a tour around the country and meet everyone. Pat's going to start in California, because California got it right, and they have safe staffing ratios. We're going to get a better Pat that can sit down in a wheelchair, because Pat's going to go on some walks and some 5Ks, and she's going to go to your state capitol, and she's going to come meet you all over the place. And this is going to be awesome, because you know who else gets to participate in this? Not only nurses, but also patient advocate groups. They want a piece of this too. They want to fix this problem too. So we get to bring more people to the table. Physicians want to make sure that their patients are taken care of. We need them at the table too. We need everyone talking about this. Everybody gets to meet Pat. Okay? So we're sending Pat on a tour. So Pat's coming to where you are. So our plan for Nurses Take DC 2017 is this. It's short and sweet, and you can read more about it if you go to smysofficial.com, right? The plan is we're going to take Pat. Pat's going to California. Over the next month or so, we're going to coordinate with all the wonderful people around the country that are talking about this, and we're going to map out where Pat goes. And we're going to ask everyone, are you going to save Pat? We're going to ask the ANA, are you going to save Pat? We're going to ask the NNU, are you going to save Pat? We're going to ask the AMA, are you going to save Pat? We're going to ask Congress, are you going to save Pat? We're going to ask the President of the United States, are you going to save Pat? Who's going to save Pat? So your mission, if you choose to accept it, save Pat. That's what we're going to do. Save Pat! Save Pat! Save Pat! Save Pat! Save Pat!
One last time.
Library told me I missed you once.
Okay. Thank you, Jaleel and Pat. We're very glad to have you, Pat. This is his very first appearance right here at our rally. Okay. Yes. All right, one thing I wanted to mention is we do have some literature right over here at the table where Kathy Stokes is sitting. We have Ruth Neese's 8 points about safe staffing. If you haven't seen it, and most of you probably have, but here's an actual written copy. And we also have a policy brief that Ruth Neese wrote. If you are intending to go visit your senator or representative tomorrow, we have that information to help you with that, or just to take home with you and copy and spread around to all your friends. So at this point, I'm going to turn the program over to Doris. And Doris Carroll, she's Vice President of the Illinois Nurses Association. Yes, she is. And she's going to take us through the open mic session that we have. We have several people that are going to speak. And lunch may come simultaneously, but we'll just keep it going. Okay, here you go, Doris.
Thank you.
You want this down?
I'll take it like this.
That
Thanks.
girl.
Hey, I'm Doris Carroll from Chicago, Illinois, and no, I'm not Batman Dad, but I decided a few weeks ago to offer an opportunity for nurses across the country to tell their stories. And I wanted them to talk about their situations in working in long-term care, working in ICU, working in clinics, about what makes being a nurse great, but also what makes it so difficult. And so I offered them to wear a mask, but you know what? Everyone wanted to speak as who they are, and that is so awesome. So without further ado, I want to have Gail step up to the mic. Please welcome Gail. She's talking about her story. Thank you.
Fabulous. Good afternoon, my fellow activists. My name is Gail Wetherill. I come without a mask today. I am who I am. I'll even be happy to spell the last name if you missed it. I came to D.C. from Charlottesville, Virginia, where my nursing career began 36 years ago. On May 18th, 1980, I walked the lawn at the University of Virginia and entered the greatest profession on earth. My hopes and my heart were high, as they remain for many wonderful years in critical care. In those good old days, I often took for granted that there was time to counsel the bewildered family, asking that everything be done without knowing what that meant. Time to crank up Wolfman Jack on the radio and break it down with a couple of guys who were stuck on the ventilator for months and bored beyond tears. There was time to soak and massage the feet of the meanest woman on earth until she was practically cooing and finally cooperating with her care. There was time. But now it is 2016, and here we are. My beloved profession has unfolded down many amazing and unexpected roads. But until now, no road has broken my heart in the way that the monetization of health care in our country has. For the past several years, I have worked in long-term care with our most vulnerable elderly. Long-term care continues to grow quickly as investors eye the aging boomers and see dollar signs. But they quickly learn that to achieve maximum profits, personnel costs must be controlled. In nursing homes, I see the same story year after year. A single nurse with 30 to 40 residents. 30 to 40 residents in need of medications, dressings, tube feedings, and other treatments. Families and physicians demanding attention, tracking down absent supplies and the missing medications that the pharmacy swears were delivered 2 days ago. Oh, and by the way, don't forget to supervise the 3 nursing assistants assigned to bathe, dress, feed, toilet, ambulate, and change for those 30 to 40 residents. On a good day, or in a good facility, there are 2 nurses for those 30 to 40 residents. So many times I have seen 90-year-old women confused beyond reason, left to sit in the nurse's station, crying out, "Help me, somebody help me. Why don't you stop and help me?" Deaf ears pass by as the nurse scrambles to get the 9 a.m. med pass done by noon. I have scrubbed dried feces off the skin of a dying man, but held my peace toward his caregivers. They were not monsters, There simply was not enough time. Most painful of all, I have fallen into the trap of believing that I could somehow get it all done, of being fueled by the suffering that I saw, to work harder and longer because that's what nurses do.